Good morning everyone. We are having discussion about the slap tears of the shoulder, which is very commonly seen in athletes and sports persons. So let us dive into deep discussion about this slap tears. I am myself Dr. Sharath and he is Dr. Rahul. We both are orthopedic surgeons. We will have discussion as that he is posing me some questions and I will be trying to explain the things. Yes.
Good morning, sir.
Good morning, Dr. Rahul. Yes, tell me.
Sir, what is a slap test, sir?
Slap tear. So slap is a slap. It's like you slap someone. The same thing. SLAP. Superior labrum anterior to posterior. So superior is up. Labrum is a circular cartilage which is covering the glenoid, that is a socket of the shoulder. When it starts to tear from the superior part where this biceps tendon gets attached, it is called as slap tear.
Okay, sir. So, what are the symptoms or what are the clinical features patients come with?
This is seen in someone like who is doing overhead activities like throwing or bowling, swimming, this kind of activities. So they will have difficulty in doing these activities, and as I told that this is a superior labrum, is superior part of labrum. When it gets torn from the biceps, whenever someone tries to throw something, they feel something pops out or something comes out in front of their joint and obstructs the movement of the shoulder. That is one thing. Then they feel pain, common finding. Pain is very first symptom maybe. Second thing,
sometimes they complain of a deep-seated
pain, deep-seated pain and weakness of doing these activities. Their strength of throwing or swimming, whatever they do, will be reduced. Like commonly we hear someone like volleyball player or a basketball player tells that they cannot do these activities. They feel it as a weak or the strength is reduced.
Sir, any clinical examination or any tests that are there for this?
Yeah, it's a very important question. That there is something called O'Brien test. This we do to assess the integrity of the slap or biceps. We make them to hold the hand like this and rotate inside and take this to closer to the body, and then when we rotate internally, then if they feel pain and when we try to resist their upward movement, then they will get pain, and then we make the palm face up and then resist this movement also. Tells that there is if they feel pain or any uncomfortable feeling in this area, that suggests that this biceps tendon attachment, slap is basically biceps tendon attachment which is torn.
Sir, after we clinically examine, what should we do next?
Yeah, so as you know that this labrum, that is a circular structure, it is like a circular cartilage which is deepening the socket. To understand that the socket of the shoulder, although shoulder is ball and socket joint, if you see hip joint, the socket is very deep, the ball is very deep inside the socket, whereas in the shoulder the socket is very shallow. Socket is shallow, ball is very big. So these people who have this slap tear, there is a possibility of extending of this slap tear all the way front and back. When it happens, they might feel that the shoulder coming out or popping out. So all these things are the symptoms as we discussed.
Investigation
we have to do the X-ray. Obviously X-rays will be normal because this is a problem of soft tissue, the problem of cartilage like ligaments. We don't see anything in the X-ray, then we ask them to get MRI scanning, sometimes contrast scanning, because this labrum is attached there. Only in dynamic movements it is moving. If you take the MRI scanning in a specific position, normally we take in the particular position, if it is not moving, then we will not understand whether there is really tear or it is just a fraying of the ends. If we are not able to diagnose and clinical suspicion is very high, then we can even get contrast scanning.
Sir, if the MRI shows a slap tear, what is the next procedure, sir?
Based on the age of the patient, based on the activity of the person, based on their demands, we plan the treatment. Someone is very active, elite sports person, swimmer, very young, then it is always better to fix this. Fixing meaning we are going to fix the with some anchors and knots, sometimes knotless, to attach that labrum which is torn to that original position. This is a fixing of the slab. Someone who is 50 and plus comes with a slab tear, he might not be doing such an active overhead activities. Then we do arthroscopy and then we may resect the biceps. It is called tenotomy of the biceps. Then when we resect the biceps, slab might heal there only, or we can fix the slab. But then here the concept is that we don't want this biceps to pull every moment, should not pull and re-tear the slab. Sometimes we do something called tenodesis. We resect the biceps tendon and then we are going to attach it to one of the areas in a groove, so that the biceps function is also preserved and the slab is also going to be healing. The keyhole procedure, typically 1 to 2 days of admission and 2 to 3 small keyholes or some small incisions, so as to just camera to pass inside and we make the knots.
Sir, like for our audience, how is the procedure of surgery? Like when do they have to get admitted? How many days they normally stay in the hospital? And also, what is the recovery period, sir?
Typically, these are young people. As I said, we admit on the day of surgery, and surgery can be done at like later in a day. If we admit in the morning 6-7 o'clock, we can operate by 12 or 1, and then next day we discharge. Or otherwise, if surgery is posted early in the day, like 8-9 o'clock, then we admit one day before. Then the same day surgery will be done, same evening or next day morning, we can send them home. We send them with the arm sling, and typically the 2-3 small band-aids is enough. And there may not be any much bleeding. It's a very safe procedure, and if it is done well, the person should have very good results. And then initially 3 weeks we will do pendulum exercises in the sling. We will ask them to hold the arm in the sling, and then the pendulum exercises and shoulder range of movement exercises we will do. Subsequently, we will guide them to go for strengthening exercises.
So all in all, sir, when do you think that patient will be back to normal, sir?
All in all, it might be 6 months. I feel all the sports injuries we have to give time to heal and then regain the strength, and then rehabilitation they have to do 4 to 6 months. They might go even after 2 months, but then there is a re-tear chances, and again if something happens, it is a problem. I think we have covered most of the things.
Yes, sir.
So friends, me, Dr. Sharath and Dr. Rahul, both are orthopedic surgeons. We have covered a topic of slap tear and how it is diagnosed, how it is treated, and what is the type of procedure. If you have liked this, please like it. If you have not subscribed to my channel, please subscribe to my channel for informative videos on arthroscopy, robotic joint replacement surgery, and any recent advances in orthopedic surgery and sports surgeries. Thank you.